In the first month after your weight loss surgery, you will gradually progress your diet through 4 stages. In this module, we discuss the first 3 diet stages, beginning with clear liquids and progressing to soft foods.
At midnight, the day before surgery, you will be asked to stop all fluid intake. Now, the day of surgery, you will not be given anything to drink by mouth. You will have IVs going that will help keep you hydrated. The day after surgery, the hospitals will start to give you small amounts of ice chips in the morning. If you tolerate them well, you'll be started on full liquids.
First stage of your diet is going to be clear liquids, and this is when you are in the hospital. So day 1 and day 2, if you're in the hospital still, you're gonna be on clear liquids. Kind of what to expect, they're gonna give you small medicine cups, and you're going to put your liquids in there. I would recommend that you take 1 to 2 small medicine cups over an hour period. If you're comfortable with that, then you can increase up to 4 small medicine cups. Things to expect would be your clear base broths like vegetable broth or beef broth. You may also get some decaf coffee and tea or some of your calorie-free, carbonated-free beverages. Sugar-free Jell-O and sugar-free popsicles are also considered clear liquids, but when you're eating them, you want to make sure that you are taking small bites and that the consistency is a liquid by the time you swallow it. If you are tolerating clear liquids, then you can advance to full liquids on day 2 post-op. With a full liquid, you want to make sure that is pourable. So say you have a soup, but it has chunks in it. You want to make sure you either blenderize it or you strain the soup before eating it. The full liquid needs to be pourable.
If you have your full liquid in a small container in front of you, you should not be able to draw in it. If you put your initial and your initial stays, the fluid is way too thick. You need to dilute it.
The most common types of foods that we recommend are strained or blended soups, bariatric protein supplements, thinned cream of wheat or oatmeal, applesauce, and basic V8 vegetable juice, skim or 1% milk, thinned low-sugar Greek yogurt, sugar-free pudding or custard. Keep in mind during your full liquid diet stage that you need to track your hydration, your protein, and keep your sugar intake low. As you introduce full liquids, you may find that there's going to be different times where you can tolerate more. For instance, if you're eating a thinned oatmeal, you may only be able to tolerate 4 ounces because it is a higher density food. If you're eating a cream-based soup, you may be able to take more, up to 6 ounces, because it's a lower density food. Over the first week, you are going to gradually increase your full liquids until you can tolerate about 4 ounces, which is half a cup. On day 8, you can progress your diet to a soft foods diet stage. This includes things that you can smash with a fork. So your soft fish, your soups, any type of soup is fine during this stage as long as you're chewing the chunks well. Scrambled eggs, refried beans, your applesauce, you can continue doing your yogurts and things like that. In your soft food diet stage, it's important to avoid raw fruits and vegetables. You need to make sure that if you eat a vegetable that it is canned or well steamed, and also with fruit you can do canned fruit or applesauce.
An easy way for you to remember what soft foods are foods that are slightly textured. If you think about meats and fruits and vegetables that come from a can, these are softly textured foods, and these are very appropriate foods to eat while you're on the soft diet.
As you start to introduce foods in your soft food diet, it's important to use the 3-2-1 plate method as you're eating. So what you would want to do is start with 3 bites of protein. That could be your canned tuna, your canned chicken, refried beans, and then you would want to take 2 bites of your non-starchy vegetables, so canned green beans, canned broccoli, and then lastly 1 bite of your carbohydrate. We just want to ensure that you're getting your protein in before the other food groups.
Let's take a moment to review this module. Thinking about nutrient balance and eating the right foods is more difficult when you don't feel hungry. This is why it is important to focus on your meals. Allow yourself extra time to eat. You will need to concentrate on eating slowly and learning to recognize the sensation of fullness. Use your protein drink to make sure you get enough protein each day. Introduce new foods slowly and only one new item per meal. Track food and liquid in your journal. If something makes you feel ill, your journal will help you identify it. Use the 3-2-1 plate method once you start soft foods. When you are ready to continue, use the menu on the left to select the next module.